It's all quiet here as passengers go through the routes of the arrival lane. Suddenly, attention is drawn to a passenger who slumps in front of the port health desk. Emergency services race in. Quickly, he's strapped to a stretcher just as the nurse on duty puts a call through to report the incident.
We are calling you from International Airport. There's a patient that collapsed on arrival. It's unconscious. Yes, sir. Just a few minutes ago, about 2 minutes ago, sir.
Details are sketchy. Findings reveal he's an inbound passenger from Angola traveling to Brazil. In a region where epidemic outbreaks of infectious diseases are common, this is just enough to be on the alert. The thought of a potential outbreak in Lagos, one of Africa's largest commercial cities, is one officials dread. But luckily, this is a simulation exercise. It is being carried out by the West African Health Organization WAHO to assess effectiveness of response in the context of an emergency. Leaders of the region under the economic group ECOWAS have for long sought to build the capacity of member states in preparedness and response to epidemics such as cholera, meningitis and yellow fever. Through the West African Health Organization WAHO, they support the establishment of national emergency management mechanisms for public health emergencies. And so, to test the mechanisms and procedures in place for the management of major public health events in Nigeria, WAHO, in partnership with other agencies, chose to organize a yellow fever simulation exercise in Lagos, Nigeria. Yellow fever for some time now has been under the radar. In 2006, a yellow fever initiative was launched with immunization in West Africa growing up to more than 100 million. However, speakers at this event say low vaccine coverage of yellow fever across the continent means there is a lot yet to be done.
If we wait for an epidemic, we are too late. I mean, it's a popular saying that if you fail to prepare, then you prepare to fail. I think it's really important that the simulation exercise is for us, even in a small way, with the uniqueness of Lagos, with the problems that we cannot go and simulate in all 15 countries, but it's a start. And what it will test for us will be the preparedness of the systems we have in one of the largest countries, 323 million people across the West African population, of which more than half are in one particular country. And we know the dynamics of Lagos, and not just the dynamics of Lagos, but the challenges of Lagos. So it's important that we make a start. And remember that in most things that change in life, that things that you prepare, you don't have to do it all at the same time. We use a particular policy called PDSA, plan, we do it, we study what we learn from it, and then we act on what we have done.
We want to learn lessons on the issues that matter that can be transferred not only to other states in Nigeria, but to the entire West African region, which is why it's being organized by WAHO, which is why colleagues from WHO, the World Bank, AFINET, and all the other regional bodies are all here. So this is to identify those issues that we don't necessarily think about, like supply chain that Dr. Idris just spoke about. That we in public health sometimes we only think about vaccine efficacy and things like that. But we need to actually think, how do you get messages to people? How do you get logistics, move things from one to the other? How do you go through the traffic of Lagos in an emergency? How do you get to Semeboda when you have to, and across the region? So these are issues that are important for every country in West Africa. And that's the purpose of this exercise, to identify those issues. There will be recommendations. Out of those recommendations, each of us will take it back to our own, each of the 15 countries in West Africa, and start looking at, are we prepared for this, are we prepared for that? And that will serve as a template for a response across the sub-region.
I think Nigerians just have gotten used to getting the cars without being vaccinated. And since it's a practice that many people do, without any difficulty, they would rather get the card than have vaccination. That's one. The second reason is that a lot of them are not really aware of the enormity of that act in terms of if you are not vaccinated and there is an outbreak, you are likely to be infected and you also run a risk of getting sick or even die in the process.
The goal is to make sure that we supplement the vaccination, the gap we have, while we continue with the routine immunization. So under the Eliminate Yellow Fever Epidemic strategy, Nigerians would be vaccinated over the next 10 years. So we look forward to covering the most vulnerable, unpopulated, unvaccinated population in Nigeria to make sure that we have the right immunity.
The whole essence of the exercise is not to judge whether it is satisfactory or it is not, but to be able to prepare very well in response to any eventualities, to any disease outbreak. But we've chosen yellow fever because yellow fever, we all know that if yellow fever happens in an urban setting, it's usually the impact is usually very high.
The choice of Lagos is not by sheer coincidence. At the height of the Ebola outbreak in 2014, Lagos provided a veritable turning point, albeit by chance and strategic intervention in the fight against the killer disease.
The issue of governance and leadership is key in whatever we want to do. And this is why I need to commend the federal ministries, WAHO, the NCDC for this kind of, because it's that leadership and governance that shows direction. And relating it back to our experience in Lagos during the Ebola, we sat down as a government to decide, Lagos State is huge in terms of population. We are also vulnerable to specific emergencies. So it's a responsibility to address those things for us to prepare for it. Along that line, we started building up institutions, not specifically for epidemics. And like we said, we're also vulnerable to some problems: flood, fires, collapsed buildings. And coincidentally, there was a time they said, okay, suppose we had an epidemic, how do we react? And how to make a presentation to that. And that brought us to the fact, look, whatever we do, we must prepare or start set up mechanisms to prepare for this. So nobody is prepared for it, but they need to build capacity. There's a need to show direction.
The beauty of the simulation is not that it is located only in Lagos. The beauty of the simulation is the reach of the people you see in the room. Okay, so we'll have people from across all 15 countries here. We have the people who are key in terms of country outbreaks and country epidemics, and we'll have people who also have the innate knowledge of their different countries, whether they're francophone, anglophone. But Lagos presents us with the, if you like, the large area that they themselves also have done a lot in terms of coverage. So learning from that is important. But the exercises that are going to happen will be that people will take it back. And that's why WAHO is working with Nigeria CDC to try and coordinate it across West Africa.
After the formalities of the opening, the various partners involved in the exercise took to the field so as to test and exercise their functions within an incident management system. They visited various locations that include Lagos State Ministry of Health, Lagos University Teaching Hospital, Seme Border, Entomology and Vector Control, NCDC Lagos, Murtala Muhammad International Airport, Exercise Control Room, among others.
Bearing in mind the travel issue of the patient and the fact that the patient has been to Brazil before coming to Nigeria, it's not unlikely that he was infected while overseas. Now, this is more or less like an imported case of yellow fever.
When you look at the case definition of yellow fever, it's quite broad, that it brought into the net so many other differentials, that we are having patient having history of fever and yellowness of the eyes within 14 days of onset of the fever.
And then, it was time to take stock of all that they had seen and experienced. The post-simulation phase was quite revealing.
The control room actually worked pretty much very well. It worked very well. The people responsible for the control room were flexible enough when they were receiving information concerning people trying to act their role. They kind of sent a different inject that took people off balance, and we got what we wanted to see. Having them practice their role in real life, not having something that they have thought about and everything, because basically it's to see how they think about all these things. How do the surveillance, what do you want to do? Is communication, is it vaccination? You want to do an ICG request, so we want to see them think about it naturally, not having something prepared and then coming to present.
What needs to be improved, we noticed from where I coordinated that there was some time lag, some delay between the time when that patient was seen by a doctor and when the patient was transferred to the holding area or the isolation area. So we feel that once they observe, or once they diagnose, or once they suspect that a case is that of a viral hemorrhagic fever, which is highly contagious, then there should be a provision for immediate transfer of such patient to the isolation area. And again, initially the place was not well cordoned initially, although they later cordoned the entire area so that there won't be passage of, the place will not be accessible to the passerby. So I think those are some of the gaps that we identified, and of course we hope that they will improve on that.
But the other important piece is thinking of an evaluation mechanism, so that as you go through the simulation exercise, you can actually point out the strengths of the system, but also the weaknesses. Because the idea is to identify the weaknesses, strengthen it, so that countries are ready for any infectious disease outbreak, including yellow fever.
Effectivement, la région West Africaine.
Indeed, the West African region and countries within the ECOWAS are at the risk of various epidemics, especially the risk of a yellow fever epidemic. For this reason, it is in our best interest to be well prepared to fight it.
Être bien préparé pour combattre. C'est dans ce cadre que l'OS a...
We're working with colleagues of Niger, especially here in Nigeria, to prepare this simulation exercise, which will fundamentally evaluate the level of preparation in Nigeria to prevent, detect and respond in the event of a yellow fever epidemic. The objective of this exercise is to evaluate the preparation of our country in comparison to other public health threats. I think it is very important. It is our duty and business to know what works well and what doesn't. What doesn't work well, we revise the plan, make recommendations, and devise an action plan which will allow Nigeria, which is one of the important countries in West Africa, to fill in the gaps. We are here to provide help, as you have seen, and share our experiences with Nigeria.
Going forward, WAHO believes findings and lessons from this simulation exercise can go a long way in helping member nations take adequate measures necessary for effective management of outbreaks.
The real work has to be changing the mindset of our people in imbibing the correct attitude. And I think it's things like this that can draw attention to situations like this in the country that can help us out.
As with all plans necessary in building action plans for strengthening health security, the process is continuing. Keeping stakeholders in health management on their toes so the people of the region can stay on their feet healthy, virile and productive for the good of all.